Hello and welcome to this really short video about what you can do if you get too many search results. I'll be using examples mainly from medicine today, but these tips can apply to all subject areas. The first thing to say is that it's really common when doing academic research to get too many search results. It's just the nature of the information landscape today and the nature of the kinds of tools that we tend to use to find information. What I'm going to do is present you with a few different tips and approaches to getting fewer and better results. The first thing I suggest is that you ask more specific questions. So this means spending some more time thinking about what you actually want to know. What is the research question that you're trying to answer, or what is the information gap that you're trying to fill? This can really lead you on to using more specific terms. So for example, if you're doing a kind of a clinical question, think again about the population or the patients involved, the intervention that you're interested in, and the outcomes that you're looking for. So once you've thought carefully about that, it usually leads on to choosing more specific search terms. So it may be that you need to do a few more specific searches rather than one big search. So for example, you might want to think about more specific terms for tissues or organs or conditions or treatments or populations, and use those specific terms rather than general or broad terms. The next tip is to use fewer synonyms combined with or. So if you've constructed a search which includes lots of different words that are similar in meaning, so synonyms combined with or, the Boolean operator, it may be that you've included so many terms it's made your search quite imprecise. So it may be that you can just reduce the number of synonyms that you've used, pick out some key ones, or just use one word for a particular concept. Another suggestion is to use a subject database or a specialist database. Many people start their searches in Google Scholar or in OneSearch, which is a big interdisciplinary resource to use. So it might be, if you're finding it overwhelming to look through the results, move your search over to a subject-specific database. So for example, you can look up your subject databases from your subject guide on the library homepage. In doing so, you might choose something, for example in medicine, like MEDLINE, which automatically narrows the field of results down to just those relevant to medicine. In psychology, you might use PsycInfo. In nursing or allied health, you might use SynOL. And there are subject databases in most subject areas. Another thing you can do is to use a specialist kind of database. So for example, if you're looking just for large-scale systematic reviews to find the kind of evidence for a particular intervention, for example, then you might want to go straight over to the Cochrane Library and search their database of reviews. Similarly, if you're looking for, in another subject area, for example, you're looking for consumer information, market information, company information, then head over to a specific database for that kind of information, and then you're going to get better results that are more relevant to what you're trying to do. Another approach when you're using a subject database is to utilize the subject headings if they're available in the database. So again, thinking about medicine, we have access to the medical subject headings, which is called MESH, which you may have heard of before. You can use these specific subject headings to search for very precise topics. So for example, you can use the search MESH, which is basically just a big list of index terms, and you can look up the term that you're thinking of, see what the subject heading is. So for example, if you're looking into breast cancer, search for breast cancer in MESH. It will tell you that breast neoplasms is the preferred term, and then it will give you even narrower, more specific terms of more specific types of breast cancer. You can also, in MESH, apply subheadings. So for example, if you were looking for papers on surgery or therapy for a particular kind of breast cancer, you can choose that particular kind of breast cancer and then choose the subheading for surgery or therapy. And that way you'll get all of the papers that have been indexed to be specifically about that topic. And in doing so, you can create a really precise search. Another thing that you can do, and this is applicable to all subject areas, is to set limits on your search. So when you're thinking about what you want, also think about what you don't want. And this may lead you to think about particular types of documents that you want or don't want. Maybe a date range, so maybe you're looking at the last 10 years or 15 years or 5 years, so you can limit the results that you get from within that particular date range. Also, you can limit the search to looking in just specific fields of the database. So for example, you might want to do a keyword search, but look for those keywords only in the title and the abstract of papers. And that way, you're going to improve the relevance and reduce the number. In some databases, such as the medical ones, you can also apply limits around the age of the population or the sex of the population or animal or human studies as well. And finally, quite a practical way of dealing with large quantities of results is to just relax and resort the results. So bear in mind that you don't maybe need to look at every single result, but you just need to kind of get a different window on the same set of results. So for example, in a database, you can sort the results by relevance. So that's looking for the results at the top of the list will have your terms in the title and the abstract and the index keywords the most number of times. You can sort by newest papers to oldest papers or oldest papers to newest papers. And in some databases, such as Web of Science or Scopus, you can resort the list, putting the most highly cited papers at the top. And the reason you might do this is to find those most important, impactful seminal papers right at the top of the list. So you can be sure that you're not missing anything really, really important. So those are just a few approaches that you could take to dealing with the problem of getting too many results. Thanks for listening.